Recently, I made a video. In that video, we spoke about brain fog, what are various causes of brain fog, and what are some of the self-help strategies that we can incorporate in our day-to-day lives to slowly regain back our cognition and our memory. Those of you who are new to my channel, my name is Dr. Najmun Riyaz. I'm a practicing psychiatrist in the state of New Jersey. I'm also a certified empowerment coach. I love to empower women in the workforce. I also love to raise awareness of our emotional and mental well-being by sharing videos and content through social media. Brain fog is a state where we notice these persistent cognitive deficits with consistent impairment of executive functioning and working memory. So if we're to break it down into simpler terms, brain fog means when we're having substantial difficulty in focusing, concentrating, paying attention, processing, and even retaining both new and old information. So in today's video, I thought I'm going to share with you guys a very interesting study that I recently read in Medical Express by Elizabeth Bachman from Yale. And this study was about patients who suffer from long-haul symptoms of COVID. Meaning those patients who show symptoms of COVID even after more than 3 weeks of recovering from an initial episode of infection from coronavirus. It was found that at least 10% of these people who have had a diagnosis of COVID-19 and have had symptoms of COVID-19, they show these prolonged symptoms not only weeks to months, but even years after that initial infection. Now, long-haul COVID can happen with anyone, young, old, and also those with chronic medical conditions. They can have both physical, emotional, and mental symptoms. For example, coughing, chest tightness, shortness of breath, headaches, muscle aches, diarrhea. But what is most bothersome for a lot of them is this debilitating fatigue that they notice, this feeling of being run down and feeling very tired. Simple tasks like exercising, walking, or even doing daily household chores can be very exhausting and difficult for them. But more so that what gets them very concerned is this brain fog. So this article mentioned a breakthrough work done by 2 Yale researchers, Dr. Amy Arnsten and Dr. Armin Zaidi. Dr. Arnsten is a professor of neuroscience and psychology at Yale University, and she has done extensive research on cognitive disorders and vulnerability to mental illness at a molecular level. She has developed a drug named guanfacine for attention deficit disorder, or ADHD. And Dr. Zaidi is currently a neuropsychiatrist and a neuroscience researcher focusing on traumatic brain injury and chronic traumatic encephalopathy. Both of them have been studying brain fog in these long-haul COVID patients and found that a combination of this drug, guanfacine, and a supplement called N-acetylcysteine can either lessen or even eliminate brain fog. While the number of the patients they studied was very small, but it seemed like it had a very promising possibility of finding a cure for this brain fog. Now, guanfacine, besides being used for ADHD, has also, interestingly enough, been used extensively for its off-label use in traumatic brain injury and PTSD, both of which are associated with brain fog. Both scientists agree that while we need larger placebo-controlled clinical trials to establish that these drugs are a confirmed treatment for post-COVID-19 neurocognitive deficit, but what they're saying is that these patients can obtain them from their providers if their providers agree to prescribe them. These drugs are very affordable and widely available. Now, because they're FDA approved and have been used for years for other conditions, so their safety has been established. Guanfacine is in a class of medications called centrally acting alpha-2A adrenergic receptor agonist. Guanfacine is used to treat high blood pressure. It decreases the heart rate and relaxes the blood vessels so that the blood can flow very easily throughout the body. Some of the most common side effects are dry mouth, tiredness, weakness, headache, irritability, decreased sexual ability, decreased appetite, stomach pain, nausea, vomiting, constipation. And some of the more serious side effects are like fainting, blurry vision, rash, or slowed heart rate. So what is the underlying mechanism through which this medicine, guanfacine, helps with the brain fog? Now, research is showing that guanfacine strengthens the prefrontal cortex connections and protects against inflammation and stress, which is exactly why we get brain fog in the post-COVID patients, because the infection of the virus leads to inflammation of the brain connective tissue. The second medicine, which is rather a supplement called NAC or N-acetylcysteine, is an antioxidant and an anti-inflammatory agent that can be used to treat in these neural regions. Dr. Zaidi, as per this study, has treated about 12 patients who experienced post-COVID brain fog, and he treated them with 1 milligram of guanfacine at bedtime, and if they tolerated it well, then the dose was increased to 2 milligrams after 1 month. It was also used in combination with at least 600 milligrams of N-acetylcysteine every day. Out of these 12 patients, 8 patients reported substantial benefit with improved memory, organizational skill, and ability to multitask. For some of them, the brain fog was completely resolved, and they started resuming their normal activities. 2 patients, according to the study, were unavailable, and the other 2 discontinued the medicine due to side effects, including low blood pressure and dry mouth. Since then, the researchers have modified the regimen from an immediate release form of guanfacine, which is a shorter acting, to a longer acting or an extended release form, which reduces the risk of the side effects. So the take-home message is there. If there's anyone out of you there who is watching this video and has experienced this brain fog, either due to a post-COVID long-haul symptoms, PTSD or ADHD, or other medical or psychiatric conditions, besides, of course, treating the underlying cause of this brain fog, you may want to show this study to your providers and see if you could be a candidate for this combination therapy of guanfacine and N-acetylcysteine. But I think it's equally important that we also try those self-help strategies that I mentioned in the previous video, which have been researched and proven to help with the brain fog. For example, exercise, proper hydration, staying away from pro-inflammatory foods like red meats and dairy, consuming foods rich in antioxidants like fruits and vegetables, incorporating some Mediterranean diets, performing relaxing activities like yoga, mindfulness, meditation, staying away from illicit drugs and alcohol, developing some healthy hobbies, and healthy connections with your friends and families. And lastly, just a disclaimer, please consult with your healthcare provider before you decide to take any supplement, or if you are starting a structured exercise program, just to make sure that it's safe for you to do so. I have also attached a link to all of these articles and the references that were used in making of this video underneath this video. Stay safe, and please don't forget to subscribe to receive future videos on your emotional